Now we will start discussing the substances that act as agonists and antagonists of the different subtypes of opioid receptors. The first in our list are the ligands that activate mu-opioid receptor. This is mu agonists. We have selected two examples here. The first are the endogenous peptides that have the highest affinity for mu receptors. These are the endorphins, mainly beta endorphin. It has the highest affinity for mu receptors and lower for delta and kappa. The second is an exogenous drug. The drug is morphine and it has greater affinity for mu receptors than for kappa and delta. Naloxone is a drug in clinical use that acts as an antagonist of mu receptors. Please note that the naloxone icon makes almost a perfect match with the mu receptor. This illustrates the high affinity for the receptor. Let's discuss now the anatomical distribution of opioid receptors. There's something worth noting here is that there is an overlap between different receptor subtypes and the anatomical region where they are expressed. So, in the case of mu receptors, they can be found in the spinal cord, mainly in the dorsal horn, where they modulate pain processing, in the brainstem, in the periaqueductal gray, in the thalamus. This is an important station in ascending pain pathways, and in the brain cortex, especially at lamines 3 and 4. Effects upon activation of mu receptors include cerebrospinal analgesia. This is caused by receptor activation in the periaqueductal gray, thalamus, cerebral cortex, among other anatomical regions. Respiratory depression, which is produced by effects on the respiratory center, making it less sensitive to carbon dioxide concentrations. Euphoria is a profound sense of well-being. Sedation, decreased GI motility. This can lead to constipation, and constipation is one of the most troubling side effects in patients under opioid therapy. Meiosis, which is contraction of pupils. Opioid receptors activate the Edinger-Westphal nucleus. This is the accessory parasympathetic cranial nerve nucleus of the oculomotor nerve. And physical dependence. Mu receptors have important interactions in the reward pathway, modulating dopaminergic neurotransmission. We will now move to the delta receptors. In the slide, we'll see the molecules that act as agonists of delta receptors. First, the endogenous peptides with highest affinity. These are the enkephalins. They also bind to mu and kappa receptors, but they have higher affinity for delta receptors. The exogenous drug that acts as an agonist of the delta receptor is GPDA. This molecule is used for research purposes. The drug that acts as an antagonist of delta receptors is the same that for mu receptors. Naloxone also blocks delta receptors, but if you pay attention to the icon, you will see that there's not a perfect match at the binding site. The intention is to show that naloxone has a lower affinity for delta receptors than for mu receptors. Delta receptors are expressed in a number of CNS locations. These include the olfactory bulb, cerebral cortex, nucleus accumbens. This region is thought to play a role in reward circuits and the processing of pleasure. Amygdala, involved in the physiology of memory and emotional reactions. And finally, the pontine nucleus.
Now,
Let's see the physiological effects after activation of delta receptors. Spinal and supraspinal analgesia. Some findings suggest that delta receptors may produce mainly spinal analgesia. Inhibition of gastrointestinal motility. This effect is shared with mu receptors. Respiratory depression. There is mixed evidence about this effect. Some researchers suggest that while a delta agonist at high doses might produce respiratory depression, low doses could have the opposite effect. The last classic receptor we are going to discuss now is the kappa receptor. As with mu and delta, we will study its main agonists. The endogenous opioid peptide with the highest affinity for kappa receptors is dynorphin. Dynorphin has also some affinity for mu and delta receptors. Ketozosin is the name of the exogenous drug with the highest affinity for kappa receptors. It is a drug used experimentally for research purposes. Finally, let's find out which drug acts as an antagonist of kappa receptor. We can see again that naloxone binds to kappa receptors. But if you take a closer look, you'll see that the naloxone icon doesn't match perfectly the kappa receptor. So what the diagram wants to show is that naloxone has lower affinity for kappa receptors than for mu receptors. So, what is the anatomical distribution of kappa receptors? They are expressed in the limbic system, in the hypothalamus, where they can influence hormone release, in the brainstem, in the periaqueductal gray, they can exert analgesic effects upon activation, in the spinal cord, where they modulate pain pathways. The following are effects suggested to be related to kappa activation: spinal analgesia, sedation, dyspnea, dependence, physical dependence, dysphoria, and inhibition of ADH release. This can be explained because of the anatomical distribution of kappa receptors in the hypothalamus. This review chart has the purpose of integrating some of the concepts previously mentioned. Endogenous opioid peptides include endorphins, enkephalins, and dynorphins, among others. These peptides have different affinities for each opioid receptor. The image shows a match between how the endorphins bind to mu receptors, enkephalins to delta receptors, and dynorphin to kappa receptors. Exogenous drug agonists include morphine, DPDA, and ketozosin. And the point of showing the icon of naloxone 3 times is to show that the antagonist binds to the 3 receptors, but with higher affinity to mu receptors.